Okay, welcome everyone. As mentioned before, my name is Cody. I am from our Future Students team here at University of the Sunshine Coast. I'm joined by some special team members here tonight. We have our discipline lead of physiotherapy, Cherie Wells, who will give us a wealth of knowledge across our programs, not just physiotherapy, but like-minded programs like orthotics and prosthetics, as well as occupational therapy, sports science, clinical exercise physiology, and a range of pathway programs as well. We will have a student joining us later on. I believe she has just finished her first year, moving into her second year. Oh, here we go. Hi, Maggie. Nice to see you. And we'll get to meet her later on when we move on to our Q&A panel discussion. But for now, we'll get started. If you do have any dying questions throughout the presentation, even now as you're just getting started, there is a Q&A tab at the top or bottom of your screen. Now, what you can do is chuck a question in there. We have our three team members, Seb, Charlie, and Jody from our Future Students team, who will start answering them throughout the evening. Now, you can ask questions anytime you like, so start chucking them in now. Or if you want to save them for the Q&A, you can save them for later on as well. Thank you very much. We acknowledge the traditional custodians of the land on which we work and live and recognize their continuing connection to land, water, and community. We pay our respects to elders past, present, and emerging. Now, a little bit about University of the Sunshine Coast, or what we call UniSC, is that we are a multi-campus university. I am actually based on our Sunshine Coast campus, and I'm actually here today, which is fantastic. It's a little bit dreary, but however, it's usually a very sunny place to work. We also have Fraser Coast, Gympie, Caboolture, and Moreton Bay. Now, Moreton Bay is one of our other full-service campuses. It is a very large campus, as you can see in the photos on the screen, where it's filled with the beautiful facilities. It is quite young and is attached to also our public transport as well, such as the train line that goes all the way to Brisbane City. Fraser Coast, Gympie, and Caboolture are one of our smaller, more regional campuses. And the really great thing about studying at one of those smaller campuses is the personalized relationships you do get. However, I know Cherie is based on our Sunshine Coast campus, and I can really tell she has a great relationship with Maggie, where we do offer those more smaller class sizes and personalized relationships as well. So outside of our campus location is all about how do we get you to that finish line? And it is because our range of support services. We are recognized for five-star student support from the Good Universities Guide for 13 years in a row, which is pretty lucky. And that is because we offer a range of different services. We have academic and study support. We have our careers and employment team, health and well-being, financial support, and scholarships. In fact, scholarships is such a simple application process. It is one application which puts you into more than 90% of scholarships that are available. Although applications are closed already for semester one, or what we call trimester one for 2026, they do open again at the middle of next year. They are available for new and current students. So even if you're a current student with us and you are looking to get into physiotherapy, you can still apply every single semester throughout the whole entirety of studying at UniSC, which is fantastic. We have student groups and partnership opportunities, counseling, disability and equity, as well as an amazing student success team who will start checking in with you in your first couple of weeks of study. Now, if I could make a high recommendation of getting study started at UniSC is that once you do accept your offer and you're enrolled, keep an eye out for orientation. Orientation offers a range of these services during that week where you can get academic and study support or connect with our library. They have so many different services available to you, including the fact that you can meet other students and, have the chance to have a study buddy, for example. Highly recommend going on campus the week before studying your week one of studies. It is a really great activity where you can meet other students. I think this is a really good part to hand over to you, Cherie. We'd love to hear about not just the physiotherapy program, but if you could first introduce yourself, a little bit about your work experience, maybe some research that you've completed. I'm sure the attendees tonight would love to hear more about you as well. Thank you very much.
Thank you very much, Cody. And hello, everyone, and welcome. My role here at the university is Head of Discipline of Physio, and I've had the delight of setting up this program from scratch. It is our first year of operation here at UniSC at the Sunshine Coast campus. And I come from a lot of different unis. I don't know where I come from because I've worked at about 5 different universities and been involved with several program setups. But this is my last. This is where we're trying to bring all the good from all those different unis and in one place here in the Sunshine Coast. The focus of our program is really on equipping our graduates for success in the workplace where there is a demand for physiotherapy services. So there's a particular focus on private practice work readiness, aged care, disability, but also care for Indigenous populations. We also are very passionate about seeing students' employability to be maximised throughout the program. So one of the unique selling points of our program, our 4-year Bachelor Honours program, is that students also will obtain a Diploma of Allied Health Assistance after their second year of physiotherapy study. And that's designed to help them find work in a health-related area of practice, improving their student and final graduate employability. And that's where some of my research is focused on graduate work readiness and particularly for private practice. As a physio for 20 plus years, I know that there's been a lot of changes in physiotherapy where it used to be that physiotherapists would go into a hospital first and then private practice. But these days we see approximately 80% goes directly into private practice, where the support systems and structures may not be in place as they would be in a hospital environment. And it's really important that we as educators prepare you well for that new world of physio. So our Bachelor of Physiotherapy Honours program is a 4-year degree. All students graduate with an honours degree, but there is a clinical and a research pathway, with the clinical pathway being focused on preparing you to be a physiotherapy clinician, and the research pathway giving you an accelerated pathway to a higher research degree, such as a PhD and direct entry, if that's the career path you wish to follow. We strongly are engaged with our clinical partners. We've got incredible support for clinical placements here in our Sunshine Coast region, with a definite need for physiotherapy graduates and employment opportunities. So there's 1,000 plus hours of experience in placement that you'll undertake as a physiotherapy student, and those placements start in second year. We also have embedded some sports training experiences as well, alongside allied health assistance, which again is helping you with your student employability, but also your skills that will be helpful to you as a physiotherapist. Your placements will be across a range of different settings, not just private practice. But as I said before, the private practice employability is something we focus on. And it's there where physiotherapists act as primary contact practitioners, which means that anyone can walk in the door with anything and we should be able to safely refer as appropriate. And physiotherapists work across a number of different clinical domains: musculoskeletal, which is kind of muscles, joints and bones and those sorts of injuries and problems people have; neurological disorders, where people have issues with their brain, spinal cord or nerves after injury or disease; cardiorespiratory physio, so also people have heart and lung conditions, with the overall focus being on helping clients improve their movement and functional ability and quality of life. So it's a really rewarding profession. We treat young babies through to older age. It's very diverse in the places you can work and specialised areas you can develop experience in, and so there's something for everyone. The benefits of coming to UniSC for physiotherapy is we are new, we are innovative, and we are agile in the way we are developing curriculum through consultation with stakeholders and really focused on enhancing the student experience. It's a very practical course with a high number of practical lab hours, which students really enjoy practicing on each other from the first week. And we also prioritise interprofessional collaboration. That's working with other health professionals and developing skills and working with others to provide client-centred and effective care. It is a competitive entry ATAR score there of 96 this last year, but some of the following slides will talk about adjustment factors that you may be eligible for, and also different schemes to help entry, because 50% of our cohort will come from our local area, and we actually had a lower ATAR entry score of 92 for people who fulfilled that criteria. We only have entry in trimester 1, and generally it's a full-time degree, but there is options for part-time study in the first couple of years if required. But once you hit clinical placements and academic work in year 3 and 4, it's an accreditation requirement that you are studying full-time. But there is also opportunity to discuss special consideration if you meet that criteria. The only prerequisites is that you need to have studied English. So I would say it would be recommended to have undertaken one of the sciences, because it is an applied science degree. We're fully accredited, by the way, with the Australian Physiotherapy Council, and jumping all those hoops that we need to jump as a new program. So physiotherapy is a wonderful allied health profession, but it's also closely linked to other health professions and allied health choices. So we're just going to take some time to walk through some of those alternatives. Many of these programs have similar courses to physiotherapy. And if you started in one of those courses and you didn't find it was right for you, you could look at transferring and applying in subsequent years. But conversely, if you don't get into physio, you might actually find one of these other careers actually suit you more than you think or knew about. So I'll just kind of highlight some of these now. The Diploma of Allied Health Assistants is a program that I recommend people consider if you don't get the ATAR that you're hoping for physiotherapy, and you're wanting to build or increase your ATAR and competitiveness for getting into physiotherapy. One of the benefits of studying the Diploma of Allied Health Assistants at UniSC is that it is considered by QTAC as similar to the bachelor, a first-year bachelor course in terms of your converted ATAR that you'd get. So you'll actually find that when your ATAR is recalculated by doing the university level diploma course rather than a Cert 4 at TAFE, you'll be eligible for a much higher ATAR, which can make it easier to get into something like physiotherapy or other allied health courses. And the other benefit is you're getting that university experience and getting the opportunity for course credit with, up to 50% of those courses being common with physiotherapy and other health professional programs. It is offered at all 5 campuses now, but most of the content is delivered online with intensives at the Sunshine Coast campus. But there are also other options that you can explore if you prefer the face-to-face courses offered at each of those campuses as well. And for the first time this next year, we also offer the diploma as a mid-year entry point as well. So if you're wanting a little break before you undertake a full university degree, that may be another option you can consider, or if you're working and wanting to do things more part-time. The Bachelor of Sport and Exercise Science is a long-standing course here at UniSC, and as a graduate of a Bachelor of Sport and Exercise Science, you will work with particularly healthy populations and helping them with their exercise and sport science with lots of different kind of roles in exercise and sports settings. There's a strong research focus within this Bachelor of Sport and Exercise Science. So you are trained as a scientist. So if you love sport and you love knowing how the body works, this may be the program for you. Certainly the ATAR is much lower at 50, and you can commence either trimester. And I understand it's offered at Moreton Bay as well as the Sunshine Coast. With this particular program, it is recommended that you have studied not only English, but maths, biology and science. Again, I guess the body is about science often, so it is just recommended though, rather than being a requirement. Clinical exercise physiology is somewhat similar to the Bachelor of Sport and Exercise Science, but it goes further with an extra year of study, a 4-year program, with the ATAR being slightly higher at 70. And a clinical exercise physiologist will work with patients who have pathology or injury and illnesses as well. So they won't be just looking at healthy populations and exercise. So, again, there's very similar kind of subjects to what a physiotherapist will undertake. In fact, in year two, half of the subjects are the same, and pretty similar, probably two or three are common in the first year. What's different about a physio and exercise physiologist is really in different skill sets we have and roles we adopt. So I mentioned before that physiotherapists work across a lot of different settings. You'll see clinical exercise physiologists are more often private, but not necessarily exclusively, but more often in the private sector. And they are using exercise as their only or key modality or intervention for people with problems. Whereas a physiotherapist would look at exercise and hands-on manual therapy, education, and other aspects. And we're also trained in diagnosis as physiotherapists and primary contact management of those musculoskeletal conditions in particular. So you'll find that a physiotherapist is probably the first person you'd see, whereas an exercise physiologist might be after you've got a diagnosis, you could see them for an exercise intervention. Occupational therapy is very close to physiotherapy in terms of helping people with their movement and function, with an extra focus, I guess, on that functional side and their independence and activities of daily living and of interest and occupation to those individual clients. So if you like working with people, spending a lot of time with people and helping them overcome challenges they have in their life, building on their strengths and linking them up with supports, whether that be within themselves or surrounding environment and community, then OT may be for you. OTs generally tend to be very patient, kind people who love speaking with people. So they'll work in I guess, a more flexible, less clearly defined kind of environment, and more so involved in longer term care of clients as well, through including mental health and then from child development through to older age as well. But really looking at the functional everyday activities that people undertake. Prosthetics and orthotics. This is one of two programs in the whole country that is offered in prosthetics and orthotics. And we have we've got a new prosthetics and orthotics department up here at the Sunshine Coast University Hospital that I know is very excited that we have this program, which is a specialised course, particularly helping people who have perhaps lost a limb or would benefit from prosthetics or orthotics devices to help them with movement and function. So if you're a person that particularly likes understanding how the body works and mechanics, and are innovative and quite practical, you might find this course is in your interest area as well. We again have a lot of common subjects with prosthetics and orthotics, and we're looking forward to undertaking some shared interprofessional learning in future years as well. It's a 3-year course, so a bit shorter than your clinical exercise physiology course, and also occupational therapy with an entry requirement of 70.
Thanks, Sherry. And that's really good to get a strong understanding. Obviously, we do offer a range of like therapy-based programs, and they do have a lot of overlapping and share a lot of courses between them, which is really great to see I think their values all very aligned. They want to work in their communities and work with patients and be very patient-centered. And I think seeing the differences between them is also really important. But also the opportunities where you could start off in one and you could have those experiences, including placement experiences, and then you might find, you know what, I work with a lot of these students and I've had these experiences. I might actually want to do the move over, and those options are available. It's worth checking in with your study advisor and our Student Central team if you are planning to make a change throughout your study journey. So I guess the next step is, how do I gain entry into university? We are starting to see a few questions coming in about how do I transfer, or if I'm currently studying this, what can how does that give me credit, or how do I gain entry? So I guess your first step is understanding, what skill set do I have now to be able to apply at UniSC? So there's a few ways to gain entry. First step is ATAR. If you are coming from school or you've finished school recently, you can use your ATAR score to be able to gain entry into physiotherapy or any of our allied health programs. This, as well as early offer guarantee, which is a year 12 scheme where it's the recommendation of your school. Now, physiotherapy is not included in this. However, a range of our other allied health programs are included in early offer guarantee. This has closed now for 2025, but will open again next year. So if you're currently in high school now and you're attending tonight, maybe you're in year 10 or year 11 and you're starting to make plans for after school, which is really impressive, start thinking about what programs are included in EOG or early offer guarantee. We also have a fantastic bridging program called TPP or Tertiary Preparation Pathway. This is a fee-free bridging program. This gives you a range of skills such as academic writing, literacy and numeracy support, journal articling, and further referencing support that you may need throughout all university programs. Now, although completing this bridging program will not unfortunately give you the skills directly to gain entry into physiotherapy in terms of the rank score you need, it will help you get direct entry into our diploma pathways or other like-minded programs, such as maybe exercise sports science, orthotics and prosthetics, and a few other allied health programs that have a slightly lower score compared to physiotherapy, which requires you to get a rank or an ATAR of a 96. We do have that diploma level of study. Now, Diploma of Allied Health is a fantastic program. That is a key example, I think, what we've designed to create a direct entry or a straight pathway into the Bachelor's of Physiotherapy and a range of our other programs where you'll receive entry into physiotherapy as long as you've passed and completed as well as received the ranking score you need. So, for example, if you get all passes for the Diploma of Allied Health, you will receive a ranking score of roughly around a 93 to a 95. So your goal is to obviously do much better than just a pass. However, with the completion of your diploma, as well as hopefully receiving some good grades, that will give you the ranking score you need to hopefully move into the Bachelor's of Physiotherapy, as well as receiving some credit, which is fantastic. We also offer selection rank using a VET qualification. So if you've done a Cert 3, a Cert 4, or a diploma, for example, a Certificate 3 gives you a rank or an ATAR score of 68. A Certificate 4 gives you a ranking score of 74, as well as a diploma, a TAFE diploma, not a university diploma, gives you a ranking score of 82. And you can use this to gain entry into university as well. So keep that in mind if you are interested in any of the programs we have highlighted tonight and you do have that skill set, you can use that to apply and gain entry. And as well, if it's very like-minded, you may even be able to apply for some sort of credit or even just understanding what our RPL or recognition of prior learning exists. We also have Access UniSC scheme as well as our Ideas Access scheme, but we want to highlight two specialty access schemes we have in our part of our admissions processes. And Sheree, I would love for you to talk about these a little bit more in depth because these are designed around our physiotherapy and some of our other health-based programs.
Thank you, Cody. So I'm very excited to announce that we've got this Indigenous Health Admissions pathway for Aboriginal and Torres Strait Islander students who would like to study physiotherapy. This is a unique pathway that I actually think, from my knowledge, is probably makes the barriers or the challenges it, low, I guess, for entering into physio and probably the easiest across the country that I'm aware of. So basically, if you don't get a 96 ATAR, but you meet the criteria for admission with a minimum ATAR of 80, you will be eligible for consideration for entry and will need to complete a culturally sensitive interview with myself and someone from the Barunga Centre to make sure that you have the support and the capacity, I guess, to excel in the physiotherapy program. So that's something that we're really passionate about increasing the number of Indigenous physiotherapists in Australia, and we've, I guess, really looked at some of the barriers, and I think by reducing the ATAR requirement, that will hopefully increase our numbers. The Regional Health Workforce Scheme I mentioned earlier, and this is where we have a quota system where 50% of our students will come from our local council areas of Noosa, Gympie, and the Sunshine Coast. And if you've lived for 5 years continuously or cumulatively over 10 years, you will likely meet the requirements for this scheme. And this is where we had the entry requirements for students to be less, as I said before, than the 96. So it was 92 last year. So we actually fill that quota first before we offer other places to other students and applicants. And that's because we're committed to building the local workforce here in the Sunshine Coast and regional areas.
Thanks, Sheree. So I guess now that we know about our pathways, our programs, our locations, it's probably like, how do I apply? Like, what is the process here at UniSC? So it's really nice and easy. First, you need to check out what program you're looking at studying with us at UniSC. Searching for the entry requirements. As we mentioned before, there is some prerequisites on some of our programs, but there's also some recommended studies. Now, just keep in mind, if you don't have those recommended studies, that is no problem at all. That is literally there as an understanding of the skill set that you'll need throughout your study journey. And if you do have that, fantastic. And if you don't, we will be able to give you those skills throughout your first year of studying with UniSC. And finally, when you are looking at applying, you are actually going to apply through QTAC. QTAC is the Queensland Tertiary Admissions Centre. This is a third-party website and provider that all universities here in Queensland use as a admissions process where you actually get six preferences into universities or six preferences to choose what you'd like to study at any institution. So, for example, let's just say you are very passionate and want to study physiotherapy with UniSC. In your six preferences, number one preference is your dream program, all the way through to number six that you might have as a pathway program. Now, if it is only physiotherapy that you want to study, that is completely okay. However, what I recommend is still offering some other provided pathways into that dream program if you don't have the entry requirements. For example, you might do preference number one as the Bachelor's of Physiotherapy and Honours. And then for preference number two, you might do the Diploma of Allied Health, knowing that if I complete the Diploma of Allied Health, I've set myself up to get direct entry as well into the physiotherapy. Now, as a third preference, I would highly recommend putting in TPP, Tertiary Preparation Pathway, which is our 6-month fee-free bridging program to get you all the skills you need to study with UniSC across almost any degree that we offer. So keep in mind that although you might just want to apply for the one program, it is nice to know that you do have a few backup options there. And I do highly recommend that even if you've got a sure thing to getting into your dream program, where it'd be occupational therapy, orthotics or prosthetics, as well as exercise sports science or exercise physiology, putting in the Diploma of Allied Health or TPP as some secondary options, just so it secures your application, is a really great idea and assures that you have a offer with us as of February next year. Now, if you haven't applied just yet, we are supporting all our attendees here tonight that we will give you a free QTAC voucher, which is at a value of $155. If you have already applied, apologies, there is no redeemable options for this. But for those who have not applied just yet and is thinking about studying with us in February next year and looking at applying in the next offer round, which is at the end of this week, the last dates are available, is that we will send you a quick email tomorrow with a copy of this presentation as well as a link to apply for a QTAC voucher. We'll get those back to you within the next 48 hours where you can use that to create an application and apply with us. This is probably my favorite part of the evening where I'm going to invite Cherie as well as Maggie, who's actually sitting right next to her, to, I guess, learn a little bit more about all of our programs. But for our live audience, this is an opportunity for you to ask Cherie as well as Maggie a range of questions. It could be around student life, it could be around careers and opportunities, it could be around entry scores and pathway programs. Ask them all now in the Q&A tab at the top or bottom of your screen, and we'll be able to ask Cherie and Maggie. Now, although we've been able to learn a bit more about Cherie and her skill set and obviously what she contributes to the university, Maggie, I'd love to introduce you. And if you could just let us know a little bit more about yourself, where you're up to in your study journey and about the program you're studying.
Yeah. Okay. Hi, guys. Like Cody said, my name is Maggie, and I have, as you would have gathered, just completed my first year of physiotherapy at the Sunshine Coast campus. It's going to be a lot of more information coming at you, I'm sure, but it's been a really great year and I've really enjoyed myself. But first, I'll kind of tell you how I ended up here. So, I have a background as a professional dancer. Once I left that, I was a little bit unsure what to do. Physio had always kind of been in the back of my mind. I'd worked with a lot of physios. I always had an interest in the body. I liked talking to people, and they were all things that ticked that box. But I was pretty apprehensive with uni, just because it was outside of the realm of what I knew. So when I saw the Sunshine Coast was offering physio, I thought it was some kind of destiny. This is my hometown, and I left for a while, and I thought, oh, perfect time to move back. So that's been great as well. But the program here has been really easy to fit into. They've made it easy to get to understand how university works, get me back on technology and all that kind of stuff. So, of course, I wasn't a school leaver. So applying was, as Cody mentioned, super easy. I just used the QTAC website. I had all my past information from school and things like that. I could put my preferences, and I was from the Sunshine Coast. So, of course, I had that benefit on my side as well, which made it quite an easy process to get into the university. In terms of workload throughout this year, it has been probably actually less than I expected in some ways. So your actual on-campus time is about 3 days a week. There's a lot of stuff you have to do online at home to get through things, but nothing that isn't manageable with a part-time job or other things. I know people have children. I know people live in Brisbane. There's a lot of different things going on in people's lives, and they still manage it. So it's definitely the kind of course that if you want to do it, you can absolutely make it work. Yeah. You
Thanks,
can hit
Sheree.
me with some questions if you like.
Well, I just want to follow up on terms of what you use to apply. Obviously, you've had a bit of work experience and life experience prior to going to university, so you didn't come straight from high school. Was there any key qualifications you used to be able to gain entry into the physiotherapy? Because it sounds like you were able to go straight through. What skill set did
Mhm.
you have prior to be able to use as evidence to be able to gain entry into that program?
Yeah. So I did complete year 12. So I had that, and I had an OP, which was then converted to an ATAR, which I think really helped. I also had a certificate 4 and 5 in health and fitness, which I threw in there as well, because I know that would be beneficial. And then, of course, I filled in all the forms that proved that I had lived on the Sunshine Coast. So I think the group of those things really helped me in that way.
Yeah, so it sounds like you will be able to use that regional access scheme, which is really cool to hear. So you're talking about flexibility, and I would love to hear from Cherie as well. Is have you been completing all your subjects on campus? And in terms of Cherie, I'd love to know how many days do you find students are on campus in their first year? Because I know second year, and we're going to ask these questions a little bit more deeper very soon about placements. But what does the typical study load look like? What are the different types of class types that a student may have, especially in their first couple of years of studying?
Sure. Well, the physiotherapy course has program has courses in every semester. So you'll have a physio course semester one, semester two, or trimester one and trimester two. And they tend to be heavier on the contact hours because we do have 2 2-hour practical labs a week, as well as a seminar or a workshop. So that is definitely from a time point of view is probably the heavier unit or course because you will need to do some online learning to prepare for those labs. But it also is really practical and fun. So people actually were socially excited to come and see their friends and work things out together. So there's a lot of peer learning and practicing on each other and interaction and simulation in the classroom. The other courses vary in terms of how much online versus face-to-face classes there are. So when I do look at timetables, I see at least one day a week that students aren't on class, but depending on what classes you choose, you may choose to, have 3 big days, or you might prefer to have 4 slightly lighter days. It just depends what works into your schedule. I would say that we've had a lot of previous students actually in this cohort come into the program, which meant they were studying part-time, just by the point of view that they had course credit from previous sport and exercise science or other courses. So what we've been able to do for those people is work out a 2-year plan to stagger their courses. So some of them were actually studying some second year courses in first year, just to spread the load across the 2 years so that they can, work part-time well and easily around that as well. So I think, if you come in through another pathway, actually that can help lighten your workload and help you work at the same time as well you're studying. So it's actually not a bad route to take, to be honest.
Yeah, and you raise a really good point. It's very we actually have someone asking right now. It's like, oh, I'm doing exercise sports science. Do I just need to complete one semester to be able to transfer? And it's good to keep in mind that you need equivalent to be able to gain entry into the Bachelor of Physiotherapy. If you are coming from another, I guess, university degree, you'll probably need about 1 year of full study
Mm.
or what we call 8 courses or 8 units, depending on what university you're at to be able to show a ranking score, you need to be able to get into a program such as physiotherapy. So keep that in mind that if you are coming from another like-minded program, that once you have completed approximately 8 units or 1 year of full-time study, you can sometimes use this to gain entry into physiotherapy, for example. Now, in terms of credit or receiving time off your degree, it is really a case-by-case basis on the units or courses that you've completed and how much they relate to our physiotherapy program, even if you are currently studying at UniSC and the units you have chosen. So keep that in mind. And I think that another question that has come through around our Diploma of Allied Health, this is one of my favorite programs, and it's proven to be a very popular program, is if I've completed the Diploma of Allied Health, what jobs can I do in the industry at that level qualification while I move on to the Bachelor's of Physiotherapy? Sheree, would you be able to provide some examples of the work fields that they'd be able to
Sure.
enter?
Gosh, this is an area where there's lots of opportunity for work, whether it be in hospitals or in the community and in aged care and disability. Um, Basically, as an allied health assistant, you work with an allied health professional. Typically, that is a physio, occupational therapist, or speech pathologists. But we also see nutrition assistants and other kind of areas developing assistant workforces as well. Um, and it's a career in its own right. For if you're a person that is very practical and want to get out there in the workforce and help people and not have as much responsibility, but still be actively involved, it could be a really, really good career for you. Endpoint. But it also, we've seen in research, really helps your work readiness as a physiotherapist and a future allied health professional. You're gaining experience directly in the healthcare sector, understanding how all those different professions work. And if you're not sure which profession is you, I guarantee after working as an allied health assistant and even completing your diploma, you'll have a greater understanding of which one fits you better. So again, it's a great qualification to get part-time work on the side. And so you can earn while you learn, and really kind of be working towards your end career goals. Oftentimes, our clinical partners are looking to employ allied health assistants, and then you, as you graduate as an allied health professional. So you're basically getting a foot in the door early on.
Yeah, I think that's a perfect example. And I can speak, my wife, who's a women's health physiotherapist or a pelvic floor specialist, was an allied health assistant throughout her almost her whole entire 4 year program. And
Mm.
it's not just about that job in terms of just having a job. When you go to apply for your dream graduate jobs and showing that you have 3 years, 4 years of work experience directly correlated in the industry, let alone with your current employer where you're an allied health assistant, and if you really enjoy that and you want to get a graduate job there, it really puts your best foot forward in terms of your clinical experience, your work experience, as well as your theoretical and study experience as well, coming all together to apply for those great opportunities locally, nationally, as well as globally as well. Keep in mind that with these APRA registered programs such as physiotherapy is that you can take this overseas and work in these professional settings, especially over, for example, in the UK is a very common. I see a lot of graduates try to do a stint maybe for a year or two over there on a working visa, just to have that life experience as well and work, especially in those high level sporting programs that exist over there. And I think this segues really well into the next question I asked, and I want to learn more from Maggie about what she expects is going to be coming up is around placements. So in your second year, you move into your first 2 block smaller placement experiences. Besides Maggie, I'm going to ask you in a second about what you're trying to expect or what it's going to look like for you. But Sheree, can you let us know? Do we have to organize as a student our own placements, or are these organized for you? And where do these partners exist in terms of locations from your home?
Yeah, look, I'm very excited to say that we've got great clinical partner support in physiotherapy. In fact, when I first was designing the program, it just had one 120-hour placement. But when we contacted all the partners and talked to them about what we were trying to do, particularly with the allied health assistant training and getting people in the workforce earlier, we actually had double the number we required come back. So we're like, well, we're not saying no to that experience. So what we've done is actually split those 120 hours, which is required for an allied health assistance qualification, by the way. We've split them into two 60-hour blocks, and with the aim of giving students broad or diverse experiences in that year, so they get a bit of a taste for the different healthcare settings and areas of physio. So one of those settings will be definitely in private practice, and so it is your musculoskeletal and sports type clientele that you'll be working with. And as part of that 60 hours, the students will also spend 10 hours working as a sports trainer with the physio. So they're really honing their sports trainer skills and practicing those and learning all sorts of fun things with taping and massage and all sorts of kind of sideline kind of exercise work that sports trainers do with physios. Then the second placement will be, we'll just call it another placement, because we've got an amazing opportunity for a lot of students to go and work in the hospital, the local Sunshine Coast Hospital, as an assistant to the physios there in the rehabilitation unit. So this would be people who have either musculoskeletal or orthopedic conditions. Maybe they've had a hip or a knee replacement, but they also could have had a fall and broken something, or they might have had a neurological or stroke condition, and they're needing help with their mobility and walking with different gait aids to be able to be discharged home. So a lot of our students will actually have that experience in a hospitals type setting. And other opportunities are with pediatrics. We've got a lot of community pediatric partners, which is, kids. So they'll be looking at kids with disability and developmental programs and support with them. And also aged care. So we're really trying to tap into those priority areas I was mentioning before of private practice, of pediatrics and disability and aged care populations, because we know in this area and nationwide that these are the boom areas for employment and great needs in the physiotherapy realm. I should say that second placement, 10 of those 60 hours is also spent with a non-physiotherapist. So it could be with an occupational therapist or a speech pathologist or a doctor, a dentist, or someone, because again, we're looking at making sure our grads and students are really knowledgeable about the healthcare system and different ways of working, and really skilled in working with other professions. Because in the end, that makes you a better physiotherapist caring for clients, because you look at the whole person and make sure they're connected in with their whole healthcare team.
Yeah, that makes so much sense, especially sometimes in those hospital settings where there are multiple between obviously allied health support workers, from occupational therapists and hand therapists, or even nurses, all working together and serving obviously that patient for multiple needs or a similar need, but in a different way, especially like post-operation or anything like that. So Maggie, what does it look like for you? You're coming up to, well, no, you are starting your second year. You've got two placements coming up. Do you kind of know what you want to explore? I think my favorite part that's been highlighted is that although there might be an area that you might not be motivated in exploring, you're kind of put in that scenario to have a taste test. You might end up falling in love with it. Is there some pockets that you're really wanting to explore? Is there a goal in terms of what pocket you want to end up being in terms of physiotherapy?
Yeah, so this was a huge draw to physio for me as well, is the diversity of physio. So you don't have to be stuck in one thing forever, and you can kind of change between that. There is a lot of people in the course that have a really clear idea of where they're heading, but there's also a lot of us, myself included, that is especially excited for these placements and the next few years exploring the different avenues. Because if I'm completely honest, I'm interested in lots of different areas of physio, but not specifically one yet. So I think this is a really important time and a really great opportunity that we have so much time to explore these different avenues, so I can get a real idea of what it entails. Because, of course, somebody telling you what the career is going to be versus seeing it and experience are two completely different things, as I'm sure many people know.
Yeah, and that's very true. That's why placements exist, between private practice, public settings, working with obviously different professions at the same time, including different spaces. And Shree, there are some questions coming through about being recognized as a specialist, I just mentioned before that my wife's a pelvic floor specialist. Do you get that skill set within the bachelor's program, or do you walk away being a generalist and you can gain experience by choosing the correct employer, or while you're in that employment setting, seeking out micro credentials or postgrad options as well? What does that kind of look like?
Yeah, I think with physiotherapy, what you first of all need to do is just get your basic qualification. And to be registered to practice as a physio, you need to complete one of these courses that are accredited by the Australian Physio Council. And what that means is you actually are assessed across a wide range of areas to be competent. So including the cardiorespiratory, neurological, musculoskeletal areas and across the lifespan. So we carefully curate and map your placement experiences and your academic learning to make sure you meet those generalist requirements. Then when you're out and working, that's where you can start to hone your skills and carve out your niche, if you like, or stay as a generalist and keep life interesting. So sometimes people prefer to specialize, sometimes people prefer to have diversity, and everyone's different. I think it's really important to not close off your options when you graduate too quickly because you actually will get a taste of what different workplaces are like during placement, but you may find that one workplace that has a particular discipline area works differently to another, and that may suit you more because it's not just about the clientele, but it's actually the workplace and what you're doing. So I think specialization, there is a pathway for specialization, usually through postgraduate master's degrees in clinical areas. So I did a Master of it's actually was called Master of Manipulative Therapy, but it's musculoskeletal physiotherapy over in Curtin University. And that entitles me to be a titled member of the Australian Physiotherapy Association, if I chose to submit some paperwork, which I haven't done, because I went on and did further PhD study. So having a postgraduate qualification in a specialist area can get you titling within the Australian Physiotherapy Association. But there's also career pathways within that to work towards being a specialist. And there's a few specialists in our region that have to undergo further training, but you do have to have quite extensive experience before you can get there. I think when most people are thinking about specializing, it's actually just through their work choices of an area that they choose to focus on and hone their expertise on by completing different short courses rather than necessarily university courses. I'd like us to definitely grow our postgraduate options here at UniSC, but we've got to get the graduate program, the standard program in first. But I do see a lot of physiotherapists here on the coast that are really keen to further extend their knowledge. And I think that's the thing with physio. If you're not keeping on learning, you will grow bored. So it's important to know that there are lots of avenues to explore. And as Maggie said, a great lot of diversity. So there's something for everyone.
Yeah, I find it in these like clinical settings or non-clinical settings as well, from being exercise clinical physiologists or sports scientists, these fields where there is so much readily research happening all the time and becoming updated, especially from our academics or relative academics globally as well, is that it is a field for you to be able to provide the best patient care. You need to be always staying interested and engaged and seeing what new methods are coming out and really adapting those to, I guess, the way you like to work with your patients and the skill set that you have. So it's one of those fields that you can stay continuously engaged and create a very strong network of professionals inside and outside of your workplace, which is a really cool job and a really great community in terms of people that are very passionate about patients first and patient care, but also having a career that's really hands-on and really practical and where you
Mm.
can go down, I guess, the clinical way. But as Cherie, you mentioned yourself that you've gone down the PhD and academic and the research path, which has a combination of both. I know, like, for example, there are some I guess academics who are doing it in a clinical setting, as in they are working and practicing and getting
Mm.
that data through clinical practice. Can you let us know just quickly, we only got a couple of minutes left, how the honors
Sure.
component works around the physiotherapy program?
Sure. Well, as I said before, we've created this to be a Bachelor Honours program for all graduates. So, regardless of whether you choose what we call a clinical or research pathway in year 3 and 4, you will have a Bachelor Honours degree, so an AQF 8 degree. What this means is if you want to do further study in academic and research study, you can apply from either of those directly into a Masters of Research, or if you're on the research pathway, you can go directly into a PhD, which is an accelerated entry point, so you don't have to do a Masters first. So you can jump an AQF or Australian Qualification Level 8 to 10 to do the PhD. And that'll suit people who who can see that they are innovators, really trying to understand and create more knowledge, explore and understand questions. But we do find in physio a lot of physios initially just want to be clinicians, and that's okay too. And that was certainly my path. I probably went into the clinician where I was always going to be a clinician, and I didn't do the honours that was offered. Looking back, maybe I should have, but I actually went along the clinical kind of specialty path and loved that, and then got into education. And so my PhD was quite late, and it was more about where I was working, whereas others kind of know pretty early on if they want to do research. And so we'll have probably 10% of the course will go on a research pathway, but the most will probably be in the clinical pathway. It's not cutting off your options to come back and do research. It's just accelerating you towards that path if you prefer.
That's fantastic. And I think there, when you are doing the honors and if you're doing it under a supervisor, when those options do arise, you create some really long-term, fantastic relationships and people you look up to that have done some amazing things in the industry. Now, I'm going to move to my very last question. And Shri, I'd love for you to answer this as well, but I'd love to hear it from Maggie. Maggie, you started university a little bit later. You had some work experience. I'm sure you've probably been like, oh, it's been a bit. And I'm sure there's some people sitting here tonight going like, do I have the confidence and the skills I need to go on to university, especially when it's been a couple of years since finishing school? Do you have any advice in terms of your experience with your first year and where you're at now, how it's all been going? And do you have any advice that you can pass on to the students in terms of what UniSC is like as an institution coming to study?
Yeah. Well, if it makes anybody feel better, I did not have a laptop before the start of this year, so I was not across anything in that realm. Um, my biggest advice would be just give it a go, just do it because there's so many people and the diversity of people in the course is so much wider than I thought it would be. I was worried I was going to be the oldest person at 26, but there is people in their 50s doing this course and then there is school leavers. So that is not an issue at all. I would also say because it is such, you end up in such small groups within your class, you have a support system as well. So amongst our classes, we have all formed circles of people that are supporting each other and getting through lots of things together, which has been really great and not something I'd expected from other people telling me about their university experiences. So I think that's been really unique. In terms of the Sunny Coast Uni, it is that little bit smaller than some unis, which makes it an even better experience, I believe. The campus is really beautiful. It has a lot of outdoor space. It's very easy to get around. Parking is easy. So all those little things add up as well. But honestly, my advice is just do it because it's not as hard as you think it is.
Yeah, I find anything that you're naturally very passionate about and you have a fundamental interest in each course, you end up doing naturally quite good at, even if your background isn't academic writing and the other skills that you do need, you have to adapt to. Shri, do you have any final advice for the audience here tonight?
I just think that if physio is for you or one of these careers are for you, even if you don't get the ATAR in the first instance, don't give up because it's never actually been easy to find another pathway. And reach out and talk to us. I'm happy to map out, different courses you do to maximize your course credit when you come in, and you can make it work for you. And as I mentioned before, it actually was quite good. I've noticed this with people who have had a lot of course credit and have come through after doing other study, it's actually lightened their load and made it a little bit easier for life. So it's not a bad idea actually to spread it out, to be honest, the first couple of years, and then, be ready to apply yourself in years 3 and 4 where it gets that much more intense. But I would say Maggie worked very hard, and her commitment to her studies has really shown through as well. So I think do be prepared to work hard in physio. It's not an easy course. It is a demanding course, but it's an achievable course and people really enjoy it as well.
Thank you so much, Sheree, and thank you, Maggie, for giving us this student insight. And I hope to see you on campus again next year. But for now, I really hope you get to enjoy a little bit of a summer break after it sounds like it's been a very big year. But I look forward to seeing you on campus next year. We're going to start wrapping up this evening. If you do have any other further questions, put them into the Q&A box. We have Sebastian, Charlie, and Jody still answering questions throughout the rest of the evening. We'll make sure that all your questions are answered before you go home. Once again, thank you to our special panelist members for joining us this evening.
Thanks so much, Cody. All the best, everyone.
Thank you. So why UniSC? So we offer five-star student support, five-star student experience. We have a truly modern approach to teaching, as you can tell by Cherie's recommendations of our brand new physiotherapy program, where our first year cohort has just gone through. We have a passion of employability, and that is the purpose of all our allied health programs and therapy-based programs is to get you work ready and in work practice soon as possible so you can actually gain employment, as well as once you get to the finish line, be able to gain employment in your professional field. We have a high performance culture and we have a true passion for sustainability across all of our campuses, online, and a part of our ethos. If you do have any other further questions, we have a fantastic study advisory team called Student Central. Now, they have a few different options for you to connect. You can book in for a 30-minute consult, or you can actually book in for a campus tour and check out all the facilities and walk and talk about your study options. That is a simple option in terms of how to engage. You just jump on our program pages. You'll see a little banner across all our program pages that says book a campus tour or book a study consult, and you can book that at a time that suits you. We are open all throughout the Christmas period with some slight closures to give our team a little break during that public holiday so they can spend time with their family. However, if you just want to wake up tomorrow and give our team a call, that exact same team is available on 0754302890. And give them a call, talk about your circumstances. They have a wealth of knowledge around pathways and how to best prepare you to gain entry into physiotherapy or a range of our other allied health and therapy programs. Just a reminder that we do have that fantastic pathway program, the Diploma of Allied Health, which A will help you gain entry into physiotherapy, but also receive some sort of credit for that skill set. And most importantly, with the completion of that Diploma of Allied Health, you are actually now available to be an allied health assistant, and you can start working in the industry while upskilling into an area that you're passionate about. That's everything from us tonight. Although we're going to start wrapping up, we're going to stick around and answer any further questions you have in the Q&A tab. But thank you for joining us, and we hope to see you on campus next year. Have a good night, everybody.